also ensuring that yes, once I pick up something, the system should be ready to help the lady detect her cancer and refer her to the appropriate treatment in a timely fashion. So that's really the thrust of what we're hoping to do. Not and from a policy level, we have to create an enabling environment that's actually able to support the costs of care and treatment to ensure that our patients are able to complete their treatment journeys.
Okay, so please, would that be
Difficult to say what causes cancer. That's the question that we usually get asked by many patients. Is it something I did? Is it something I didn't do? The reality is that nobody really knows what causes cancer. There are some associations. For instance, certain viruses like human papilloma virus may be associated with certain types of cancers like cervical and oral and head and neck cancers. But even then, what you find is many people are exposed to the virus, but very few people go on and progress to a cancer. So what causes that switch is really the basis of ongoing research, not just in Africa, but globally. What causes the cancer? But what we do know is that there are certain things that can increase your risk of cancer, right? But the important thing to know about cancer is not having a risk doesn't mean you won't get a cancer. But having a risk doesn't mean that you'll get a cancer either, right? So one of the things that we do know, there are what we call modifiable and non-modifiable risk factors that you can change and those that you can't. And these vary from cancer to cancer. But what we do know generally in terms of decreasing your risk for cancer, because you might not be able to remove it, but what can I do as an individual to reduce my risk is one, the two things that make a huge difference are diet and exercise. Am I able to eat healthy, have a balanced diet? Oh, sorry, I thought you were asking a question. Have a balanced diet. Are you able to exercise regularly? And some people think, oh, do I need to go to the gym? No, I mean, just the fact that you're able to walk, and there are simple ways that you can ensure that you're mitigating your risk. One of the other ways that you can look at is in terms of reducing the risk is from an environmental exposure. Things like smoking, tobacco, alcohol, all do actually have an implication on increasing your risk. We know things like obesity as well do increase your risk. There are other risks that can be in the environment, like maybe your exposure to certain toxins or certain chemicals can increase your risk. Again, infections, as we've said, may increase your risk, like the human papilloma virus, and that's why there's a lot of campaigns around providing immunization to both our young ladies and gentlemen to mitigate the risks of those.